and welcome to another interesting episode of the program Health Watch. This is the only program on this station that gives you information, that educates you and enlightens you on public health issues affecting men, women and children. And today on the program we're talking about self-medication. It's alarming to find people who have constantly prescribed drugs for themselves, for their family, for their loved ones, and they also do this with so much confidence. Like you just see somebody telling you, you can take this antibiotic, you can take this by a certain time, you can take it for 6 days. If it doesn't work, you can switch to this. They even know the malaria drugs to use. It's just a very big concern, you know. And so today we'll be talking about what are the factors that are responsible for self-medication? What role do medical practitioners play? What role do they have to play in ensuring that they manage and also curb the excesses of this practice? My name is Nkem or Kibe. I know you've missed me and I've also missed you as well. You know how I love to do this with you every week. We'll go on a short break. When we return, you will meet my guest. So stick around. Health Watch continues in a moment. Stay with us. Joining us, the program is Health Watch, reaching you from your #1 station, NTA Lagos Channel 10, station for excellence. And our focus today on the program is on self-medication. I have an interesting guest here. We've been talking, and I see her as more like an entertainer, but she's a pharmacist. I'm talking about Pharm Emanuela Ezika. You're welcome to Health Watch.
Thank you so much.
Okay, before we delve into today's focus, let's look at what's the role of a pharmacist in the health sector.
Well, if you're talking about a pharmacist, you know that pharmacists are, I call as a pharmacist, we call ourselves drug experts. So we know the uses, the safe use of drug, the dosage and everything about the drug. So most times what happens is that a lot of people do not understand the role a pharmacist play in this society. Like I, for one, I'm a community pharmacist, so I am in the community. Like I practice somewhere in Akoka. What I do there basically is to ensure that medications are rightly used, the dosage, the timing, then wrong use of medication. And you can't even overemphasize the self-medication. You can't, because we see that a lot. So the pharmacists play important role in drug use and drug use basically, yeah.
So when we say pharmacist, just before we get into the focus of when we say pharmacist, tell us, I'm sure a lot of people, the common man there does not know the difference between a pharmacist and a chemist.
Okay, thank you very much, because this is the part I've been waiting for. A pharmacist is a trained expert on medications. What we focus on is the manufacture of medications. You know, the pharmacists are the people that manufacture medications. And of course, the pharmacists are also the people that are very, very vast on the knowledge, because like my 5 years I spent in school, we were just talking about medications, medication, and all. Then a chemist is, because, okay, a patent drug dealer, I would say, because a chemist can be an industrial chemist.
Okay.
You understand? But a patent drug dealer are just people that learnt on the job. So you cannot compare these people with pharmacists, because the pharmacists are trained on this. Imagine spending 5 years of your life learning a particular thing. Because in school, yeah, there are a lot of things about medications that the roadside patent drug dealers do not know. Okay. And that's why you see most times they tell them not to carry prescription medicines. They are meant to carry just OTCs, which are over-the-counter drugs. But we find out that they carry prescription medications, which is very wrong, because the pharmacist is going to tell you how you're going to use it. Then most times like this, if you come with what do they call this, a lab result or a prescription, they read the prescription. Okay. It's not just about having the medication, because you can go to a patent drug dealer and take a prescription there and you see something like 1 BD. The person will just tell you take 1 a day, but that's 1 twice a day. We learned these abbreviations in school. So a pharmacist plays a key important role in the society on drug use, because drugs are poisons when they are not well taken. But when you take them, they give you what you need. Okay. But when you don't take drugs, even as little as paracetamol is a poison. I've been on I've heard it on several occasions. People will tell you I popped for paracetamol, that a roadside chemist or a roadside patent drug dealer told me to take for paracetamol because I'm fat. No, it doesn't work that way. But a pharmacist knows that it's hepatotoxic, which is, it affects the liver because these drugs are metabolized in the liver. So they will tell you the right dosage
to take.
Yes, there are some drugs that have timings. So a pharmacist is the person that is very knowledgeable about medications. So, you know, the difference between a pharmacist and a patent drug dealer is just a lot.
Thank you so much for this clarity. So moving on now, let's now focus on today's topic. So what is self-medication? When we say self-medication, what does it mean?
Self-medication. Self-medication is taking medication, drugs. Let's come down to a layman's term. Taking drugs that are not prescribed by a healthcare expert. So it can just be an individual prescription. And this is to treat, to prevent, or to even, they diagnose themselves, people diagnose themselves and then take drugs. These drugs, they could get it from family members. I can remember on occasion someone just came and brought a drug and was asking if I had the drug, and I'm like, okay, so who prescribed, who gave it? And it was for a chronic ailment, hypertension, high blood pressure. And I'm like, who gave you the medication? It's my brother's own. My brother is having high BP, and I asked the person, who gave you that medication? He said he has high BP, so he just went into a place, got a drug and started taking. I said, this is very wrong, because no healthcare expert is even a doctor that should give you these medications.
So as a pharmacist, sorry to cut you, yes, when people come to the pharmacy to get drugs, do you ask them, do you have a prescription, do you have a, you know, because I see that a lot of times people just walk into the pharmacy, the pharmacy just wants to make that money.
Okay.
Am I right?
Okay.
And so they just walk, people just walk in, get their drugs, and you don't ask for prescription or anything. You just sell the drugs to them.
Okay, no. For this case, it's not ethical for you to do that. Okay. Most times, especially for prescription medications, like someone comes to me and I check the blood pressure, for instance. I'm giving you an example. If I see it's raised, the first thing I do is lifestyle modification. What do I mean by that? Okay, do you take alcohol? Do you take salt? Do you take caffeine? And I tell you, okay, why not for a week or 2 weeks? If it's not so raised, because there's hypertensive emergency. If it's just a little raised, I'll say, okay, well, let's do lifestyle modifications to see if it's going to work. If the person comes back, I tell you, please go and see a doctor. Okay. Because there are different classes of antihypertensive medications. I won't just say, okay, take calcium channel blockers, or take ARBs, or take ACEIs, because the doctor is in the position to actually do that, because there are a series of tests they may run and they'll see that which is suitable for the person. But me coming and using my eye, it doesn't work that way. So I won't do that. But if, for instance, now the person comes with like a lab result, let's say it's an infection, okay, and the person comes with a lab result, I can just see, because there's something called susceptibility test or sensitivity test, which shows the medication the person is sensitive to. So for that one, if I look at the sensitivity and the resistance, it will show the sensitive and it will show resistant. That one I can actually give, because I know the right dosing the person can take. I can actually tell the person, okay, you can have this medication. But just chronic ailments, no, I won't do that.
Yeah. So what would you say are the factors responsible for people that practice self-medication?
There are different factors responsible for people that practice self-medication. Okay, first, you see, this is mainly in underdeveloped country. That's when we see this. Number one, because I've asked in different, because I'm passionate, I was talking about being passionate about self-medicating. So I've asked several people. One, waiting time at the hospitals. Okay. Some people don't have that time. You go to the hospital, especially general hospital, which is affordable, and then you meet over 200 people.
The population is
much. So people don't have that time to waste. Then some other people will tell you that if I eventually get to see a doctor, they'll tell me to do series and series and series. I don't have the money. So money is another factor. Cost is another factor. Then another factor is, I don't want to say, I don't want to use the word illiteracy, but I'm trying to get a word for it. Not being very knowledgeable about what the after effects.
Like ignorance.
Ignorance, that's the word. That's another factor. Then some other people, they're just not, they don't care. but the main causes are the costs and the wait time in the hospital. That is for people that are enlightened. Yeah, but maybe the least, are we right? The less enlightened people, it could just be like they're ignorant about what this could actually happen. And then if we even come to this self-medication and all that, the people, I don't know, there's something called abo or something. If we come to that part, so you can now imagine. So even elites now take that stuff.
Okay, let's not delve into that. Okay. Who are those likely to engage in self-medication?
Those likely to engage in self-medication. As at right now, I'll tell you everybody, including me.
So when I said you're about to be entertained, okay, so why did you say that? Why did you say that?
Every single person now, because before we would always say it's the non-elites, but now even the elites are coming, looking for where to get drugs, running into the pharmacies, running into the patent drug, this thing, because the same thing I just talked about, time, the elites may not be cost.
Do you feel that the technology is also helping, is also pushing
the technology?
So you go to Google and you ask, I have this thing, I have this,
yes.
What should I take? And it just gives you...
Yes. You just even reminded me of something. I have a friend that came to my pharmacy one day, and she came with like 13 different types of antihypertensive medications. And when she came, she was like that she wants to get them. I was already fuming with anger. I was furious because I was like, why will a doctor or a healthcare expert prescribe 13? Because we call that polypharmacy.
Okay.
And we do not encourage polypharmacy that is taking a lot of drugs, because one, even the person
even when it's prescribed by a professional,
if there is a way to reduce it, we always want to reduce it so that the person can be consistent with, because if I have a lot of drugs, I have 7 drugs, and you're telling me I'll get tired, but imagine I have 2, I'll manage to take it.
Okay.
So when she came with 13 different anti-hypertensive drugs, I looked at them and I saw some of them were in the same class, and I was like, how did you get this? She said, her boyfriend has something, and so he has something cardiac something. I can't remember what she called that. They checked on Google, and they found out that these are the medications that will take care of that. I said, do you know that you're meant to? I told him, is he a non-hypertensive? I asked her if he's a non-hypertensive patient. She said yes. I was like, he's a non-hypertensive patient, and then he has this. Why not go back to the hospital to see the doctor? A cardiologist, not just a doctor, a cardiologist. She was like, that's
a specialist in that area.
Yes, a specialist in that area. She was like, oh yeah, that she would have wanted to go see the doctor, but that the thing about it is that he doesn't have time, and that she doesn't want anything to happen to him. I said, this is why something is going to happen to him, because you're having like 12 medications at once. I was like, well, I'm not going to involve myself in things like this, because I know this is totally wrong. And next I saw her, I asked her, have you gone to the hospital? Do you know she told me she had gotten the drugs?
Wow.
Yeah.
So at this point, Fam Emanuela, let's go on a short break. When we return, Health Watch continues. Stay with us. If you're just joining us, the program is still Health Watch, reaching you on your number 1 station, NTA Lagos Channel 10, the station for excellence. Our focus today on Health Watch is on self-medication, and our medical professional is still in the house, Fam Emanuela Ezika. Now, before we went on that break, you mentioned something that that amazed both of us when you said you also practice it, and I wanted to ask. I see a lot of people that when they're sick, just calling someone to get them drips and all of that. I could remember speaking with a nurse, and she said anybody that does that is not a registered nurse. So I'm going to ask you now. I see a lot of people at the top that do that a lot. They get people that bring the drip to their house, bring injections. Who prescribe this? Are they doctors? What on whose authority do they do that? I don't understand.
This question. Well, I'll answer it. Most times they are not doctors. Because now I don't even want to go to that part, because
so that's part of self-medication too, right?
Oh yeah. Okay, because we all have our part to play in medical profession. So I see nurses, especially the auxiliary nurses, prescribing medications. They come to me, okay, like for instance now we have bromazepam as a prescription only medicine. And I see a lot of them come to me like, hello fam, I want to buy Tallinn. And I'm like, diazepam, sorry. I'm like, okay, so where is your prescription? And they say I'm a nurse. I'm like, no, I won't give you. Because there is a case that I was even meant to go for of one auxiliary nurse that overdosed a particular woman of sleeping medications.
Okay.
She passed on.
Wow.
Yeah. So that's how bad it is. So whenever they come, I do not entertain them.
So I think you're just 1 out of 100 people that do this. Because a lot of people look at the profit first that comes to their business. Because everything we're doing is business.
Yes.
Even if we're professionals, we know that we need to make money. We need to, keep life. We need to keep going. And so the question will be at this point, if you're doing this, is there like a body that checks, that regulates what you do as a pharmacist?
Yes, there's a body that regulates it. The Pharmacy Council of Nigeria.
Okay.
They regulate what we do as a pharmacist. And to be honest with you, I should think that every other pharmacist should do this. We shouldn't be making profit at the expense of people's lives. That's really wrong. Any practicing pharmacist, I'm saying it with my full chest, any trained practicing pharmacist, except is a roadside pharmacist, but a roadside Simafast. I hope you understand what I'm saying. The other way around, pharmacist. That's the only people that would pick profit over life. We were trained to pick life over profit. Yeah, the money, do you want it? Yes, I want it, but not over. Because, okay, there was a particular man, why he kept patronizing my pharmacy store was basically because of this. When he comes to get stuff, I'm like, you don't need it, you don't need it, you don't need it, you don't need it. And one day he asked me, he was like, why? I was like, I wouldn't. Conscience, practice, I won't do
ethics.
Ethics. Eventually, if I get caught, what happens? My license can be seized.
Can be seized.
Yeah.
So what are the potential risks and consequences of self-medication?
The risk and consequences of there are a lot. I'll just be taking a few of them. Number one, let's go to wrong use of drug. Okay, self-medicating. The person didn't see a healthcare expert. How do you know that particular drug you are using is going to work? You may not know. It may not work. Wrong dosage is another thing. Okay, like for instance, Ampiclox, for instance, is meant to be taken 4 times a day. But people that self-medicate themselves, they take it once a day. And then they take it for funny reasons. I've heard reasons of like, I want to wash my blood. Someone came out to buy Ampiclox. I was like, for what?
Because they've been doing that over
They've been doing that. Some I even hear that they use it to stop their distance so that their menstrual flow won't come. I'm like, wow, it's new to me that as a pharmacist.
And those are not pharmacists, they don't know, they know better.
Exactly. The resistance. We cannot.
Resistance.
Oh yes, especially with antibiotics. Resistance. I am very, 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 very unhappy at times I go to hospitals and you see a lot of people that have gotten resistant to antibacterial on higher antibiotics. Because taking antibiotics, for instance, now, not taking the right dose will lead to resistance. The bacteria will multiply. And then nothing can happen anymore. Then if it's a chronic user, the person may even be resistant to the multi-drug resistant antibiotics. Imagine the kind of complications when the person eventually needs it. It can lead to death. Then treating the wrong thing. Like there are some ailments that have similar symptoms. Yeah, I was listening to someone that just that lost their life because the person was having had stomach burn and all that, and the person thought it was ulcer and kept treating ulcer until it was recently found out that it was cancer of the stomach. So imagine if that person had gone to the hospital
on time.
Because when this thing begins to spread and get to other parts of the body, it's almost like there's nothing
anyone can do about it. Wow. Okay, very quickly, in 1 minute, how can pharmacists and healthcare professionals educate patients on self-medication?
Okay, the easiest way, we in the community are the easiest people, because a lot of people work into the community pharmacy. But most times, because we may have these 2, 3, 4, 5 people, we want to take our time.
Okay.
So I always say every pharmacist should take their time to educate whoever works into their pharmacy about self-medication and the dangers it poses.
Okay.
We need to go for awareness. We need to send healthcare, as in use something that will interest them. If it's a particular thing, okay, like some places may not understand English, you get professionals that will speak their language.
Sensitize them.
Sensitize them. Very, very important. Then in the hospitals too, they should have they should flyers or adverts, even adverts on TV stations and all that. TV, radio.
That's what we're doing here. That's what we're doing in Health Watch.
Yeah. So I think with these few stuffs, I think we'll reach a certain number. Maybe not everybody, but at least we'll cover a lot of people. Yeah.
Wow, thank you so much, Fab Emanuela Ezika, for coming on the show. It was a very interesting one. Thank you so much for coming. I hope you will be able to come on the show for other topics because you said a whole lot today. If for anything, you know what people don't do? People don't know that for health information, if you get it free, I think you should upload whoever is giving out that information to you. Because if you go to the hospital, for you to even just to the consultancy fee alone for the treatment, it's a whole lot. Thank you so much for coming on the program.
Thank you, sir.
And that's the much you can take on this week's edition of Health Watch. Remember, I normally say that health conscious people live longer. You have a message, you have comments, you have inquiries, please send the message only to 0706086547 or send email to allkibeinkem@gmail.com. Thank you for being part of this week's edition of Health Watch. My name again is Nkem.
There is only one station that others look up to. A station where professionalism and class come to play. So in whatever we do, be it news, sports, politics, information and culture, even in entertainment, tourism, education, documentaries and kids programming, we set the standard others